We are about to do an experiment on ourselves to analyze our own jaw gait with the use of toothpicks. In this experiment, the toothpicks are used to help emphasize the actual jaw gait, making it easier to notice subtle changes in the opening and closing of the jaw. You may use a mirror to check your jaw gait. I do recommend using your phone to videotape yourself opening and closing your jaw at least 5 to 10 times. Drawing on paper the path your lower jaw takes when opening then closing would be ideal. This will enable you to look at it later. So let's get started. So first, let's open and close our mouth several times to check our jaw gait without the toothpicks. Make sure that you're looking at how your jaw on one side is moving compared to the other side. So we're going to use now the toothpicks in comparison to without using the toothpicks to emphasize those movements. So I try to just put it on the bottom teeth wherever you can. And then what we're going to try to do is align these two toothpicks together. So when we open and close, we'll see what's going on with that bottom jaw. Okay? Make sure you line up those two toothpicks so that you can see the subtle deviations of the lower jaw. Notice how my lower jaw pulls slightly to my right as my mouth opens wider. All right, did you see a pattern? The zigzaggy kind of going down, and it's almost straight going up, but I do believe it was leaning toward one way. And then I became a little bit more self-conscious when I was opening and closing my jaw, and there's probably a last minute as I opened up, kind of like, a drop. So basically what you're going to try to do is to draw the path or the pattern that your jaw is making, the mandible itself, to see what pattern it's making, and if there's a pattern that is the same all the way through. So what happens is when it's making a zigzag kind of pull, one side is pulling more so that your jaw drops this way, and the other one will pull and then it'll drop the other way. So they're not exactly loosening up and tightening up at the same time. So that's what we're trying to do with the gait. And of course, some of us probably chew basically in this manner sometimes, one-sided. It could be the other side. And another thing with TMJ dysfunction is we might be sleeping with our jaw clenched. So that means you're going to need a little bit of help with a bite guard. I wear a bite guard almost every night so that I don't clench my teeth and ruin my TMJ in the process. So go ahead and do that yourself. Do the experiment, this number 2 experiment, and see if you can find a pattern on your jaw gait. And then we'll discuss this, if we need to, in person in May.